Joining us in studio this morning to continue the conversation on music therapy, we have Dr. Jennifer Naidich. She is a cognitive psychotherapist who specializes in rational emotive behavior therapy. We'll definitely have to tackle that one. And also Yolanda Toth, who is director of the Cancer Patient Recreation at Sloan Kettering, and she's worked for that program for 27 years in something called diversional recreation for cancer patients. And Yolanda, let me just start with you. Thanks for being here. First
You're
off,
quite welcome.
Diversional. Talk about that for me.
Okay. The reason it's diversional is that we allow patients the choice of participating in the program or not. The reason for doing this is that patients often feel a loss of control in their lives, and giving them a choice helps them to regain some area of control, and this is very important when dealing with cancer.
When you're dealing with these patients, in terms of the music therapy, do you actually see a response, and are they giving you good feedback?
Oh, absolutely. That's one of the most wonderful things you can see. People come down who are depressed or despondent and withdrawn, and they'll sit there and listen to the music, and all of a sudden there'll be a smile on their face, and their whole countenance brightens up, and they feel reconnected again to the world, and they can realize that they can enjoy the pleasures of living even though they have cancer. And this is really important.
Dr. Naidich, talk to me. You are with cognitive behavioral therapists. That is what you are. And what is rational emotive behavior?
Rational emotive behavior therapy is a form of cognitive behavioral therapy that helps people change their feelings and their behaviors by changing their thoughts.
And music really helps in this line?
Well, music can absolutely help. It's one of many different types of relaxation training that can be incorporated into a cognitive behavioral treatment package to help cancer patients cope more effectively.
What kinds of responses are you getting from these patients? I mean, obviously, if you have someone who has cancer, maybe they're on chemotherapy or radiation, and there is a certain amount of depression. What does the music actually I mean, what's the cause and effect? I'm not quite getting it.
Okay. Well, I think that music can help fight depression in many ways. One, it can bring people back to a more positive time in their life and can conjure up good mental images and memories for them. And it can also show them that they can still find some pleasure in spite of their illness. And, you know, most importantly, I think it can help boost immune functioning by increasing antibodies and other natural cancer-killing cells in the body.
Have there been tests done in this particular
Well,
line?
there have been a lot of studies looking at cognitive behavioral treatment programs with cancer patients, not looking at music therapy per se, but you can conceptualize music as one of many relaxation techniques.
Let me ask you, in your particular program, how long has the music therapy been a part of the program?
The music therapy has been a part of the program almost since the program's inception in 1947. So actually,
so we're talking 50 years here.
Yes, we are. You know, it's been a long time around, this idea. It's just now coming into the forefront, into people's awareness that it is a tool that can be used along with other different disciplines like art therapy or guided imagery, which help the people to get in touch with the repressed feelings that they may have, and their anger and their anxieties, and bring it out into the open where they can deal with it and get rid of it.
Okay. I want to thank both of you for joining us this morning. Once again, that's Yolanda Toth and Dr. Jennifer Naidich. Thanks very much for being with us. Very important topic. Very important.